Hello guys, hope you're all okay. You're all enjoying your life and you're also enjoying watching my videos. I'm Dr. Arshad Nadeem Awan with my ultrasound and radiology teaching video. Today my topic of discussion is Wilms tumor. It is also called as nephroblastoma. Nephroblastoma is the most common malignancy in childhood ranging from 1 to 8 years of life, and this is the third most common abdominal cancer in childhood after leukemia and after brain tumor. Beside this, you should have to keep rule of 10 in your mind. In 10%, it has unfavorable cytology in unfavorable histology. 10% hypervascular, 10% vascular invasion, 10% calcification, 10% pulmonary metastasis. It has also its relevance and association with certain syndromes like Perlman syndrome and some other. It's also associated with the cryptorchidism and hypospadiasis and renal fusion anomalies. On that sonography, you may be able to see a solid spherical mass. Its echogenicity would be heterogeneous, and beside this, you may be able to see internal hemorrhage, internal calcification, and also low level debris. If there is any echogenicity within the tumor, this would be a likely fat or calcium contents. The perfect modality for the diagnosis is CT scan, and on the basis of the staging, you may be able to look for whether this is resectable or this is non-resectable. So regarding a Wilms tumor, I have uploaded a lot of videos. I have uploaded a lot of images. So these images will explain you how you will appreciate the Wilms tumor on the ultrasound imaging, how it will look like, how it will appear, how you will write the report. And beside this, at the end, I have also included the staging, at which stage it is resectable and at which stage at what stage it is not resectable. All these informations are included in this video. I do hope this would be worth watching. So let's start watching these images. Wilms tumor, which is also called as nephroblastoma, is the commonest malignancy abdominal neoplasm in children that is from 1 to 8 years of life. And it is also the third common malignancy after the leukemia and the brain tumor. But the peak age for the Wilms tumor is 3 to 4 years of life. Here on this particular image, Wilms tumor has shown, and this is predominantly solid spherical lesion. As far as internal echo texture is concerned, you can label it as slightly heterogeneous. This is small in size, and beside this you have to pay attention to whether it has any compression effects on the pelvic calyceal system or not. And the second thing is you have to look that which lobe is involved. I mean, it's in the upper, which pole is involved, the upper pole, middle pole, or lower pole. So in that case, it would be the junction of the upper and middle pole. And this is predominantly solid spherical mass with slightly heterogeneous echo texture. However, internally there is no central necrosis, no hemorrhage, or no cystic formations can be seen. I would like to explain this nephroblastoma as a slightly echogenic lesion with predominantly solid spherical mass, and it is also in the junction of the upper and middle pole. So far the obstruction or compression features are concerned, slightly compressing features are there. It causes pelvic calyceal dilatation and focal calyptosis can also be seen. However, it is not crossing or it's not breaching the renal capsule, and so far its internal echo texture is concerned, its bit happens to be the homogeneous. There is no calcification in it, there is no hemorrhage seen, there is no cystic formation in it, and there is no calcification is visible. I would comment on this slide as middle lobe or middle pole echogenic spherical solid mass without any pelvic calyceal dilatation, without any compression, without any breaching or or I mean it's not breaching the renal capsule, it is not causing any compression, and this is quite spherical. So this happens to be Wilms tumors or nephroblastoma, and you need to have the biopsy. But if you apply the Bosniak classification, so according to the Bosniak classification, still it falls in the malignant category, and it will be called as a Bosniak grading 4. So this is in the mid pole and without any compression, without any heterogeneous appearance, without any cystic degenerative changes in it, and without any calcification. Another image for the nephroblastoma Wilms tumor, but here the one important point is worth noting that so far the margins are concerned, it is slightly emerged with the parenchyma, and it may mimic as like it's itself cortical part of the renal or the cortical part of the kidneys. So that's why you have to pay attention to. If you do not pay attention, there is likely possibility that you may miss this nephroblastoma. So therefore pay attention that not in all cases it would be quite spherical, but in few cases it may be like penetrated within the parenchyma, which is quite rare. But anyhow, you have to pay attention if you are gonna find out the Wilms tumor on the ultrasound imaging. Here is the large Wilms tumor or nephroblastoma in the child of 4 years, and you can appreciate that it has grown bigger and involved the middle and the lower pole. And beside this, if you concentrate on, it is more towards the middle and it's crossing the pelvic region, or you can label it as extension into the pelvic region towards the ureter. So this is one of the important point here worth noting. The second thing is slightly irregular margins. So far the parenchyma is concerned, it is heterogeneous parenchyma. However, cystic or necrotic changes are not clearly visible. There might be hemorrhage, but you have to pay attention to, which will appear as a small cystic areas, or there may be a slight debris within it if there would have any hemorrhage. But in that particular case, it's a large lesion. It is penetrating into the pelvic region, coming out at the main junction PIJ, and then it has a very round margins, and it is in the center of the mid and the lower pole. So this is a quite big Wilms tumor, big nephroblastoma. As in the previous images, you have seen that this Wilms tumor and nephroblastoma involves the middle pole and interpolar junction, which was confined to the renal parenchyma. But here in that case, you can see that this Wilms tumor is protruding out of the renal parenchyma. I would say here that it is breaching the renal capsule, however still remains spherical, and it is heterogeneous in nature. Being a small in size, you cannot easily appreciate the hemorrhagic or the central necrotic changes, but that was the case where this is breaching the renal capsule. Again, the another example here, it is also about to breach the renal parenchyma, breach the renal capsule. It is hypoequic, it's round in shape, and internal echogenicity is predominantly hypoequic. In this particular case, you cannot see any pelvic calyceal dilatation, or there is no compression effect, there is no internal or central hemorrhage or any necrotic changes or any calcification. So this is the nephroblastoma involving the upper pole and breaching the renal capsule. Wilms tumor staging by National Wilms Tumor Study Group divide these stages into 5. So far the stage 1 is concerned in that this would be, or the tumor would be limited to the kidney, or it would be confined by the renal capsule, or renal capsule would be intact, which we have seen in the start images. So for the stage 2 is concerned, there would be local extension beyond the renal capsule into the peritoneal tissues, or might be renal vessels involved outside the kidneys. There may be some lymph nodes involved, so this would be considered as stage 2. In these two conditions, this would be totally resectable tumor. So far the non-resectability or non-totally resectability tumor is concerned, that would be grade 3 or stage 3, where you would be able to see the peritoneal implants or other than para-aortic lymph nodes involvement, or if there is any vital structure is invaded. So these all category will make it non-totally resectable, and this would be considered as grade 3 or stage 3 tumor. Stage 4, when there is hematogenous metastasis, especially to the lungs, that would be 85%. However, in the liver, this is quite less, 70%, while in bone and brain, these metastasis happens to be quite rare. And the another point, there may also be lymph node metastasis outside of the abdomen or pelvis. So if in all these conditions, in all these metastatic stages, this would be considered as stage 4, and this would again be a non-totally resectable or not resectable cancer. Stage 5 would be considered at the point where both kidneys would be involved at the time of the diagnosis, which is 4 to 13%. It likely to happen, and it is the quite severe stage of the cancer, and that would be called as stage 5. Wilms tumor or nephroblastoma has been discussed at length, with its ultrasonic feature being predominantly solid spherical mass with heterogeneous ecotexture, with irregular area of central necrosis, hemorrhage and cystic formation. If there is an ecogenic foci, maybe representing fat or some calcium, the best modality to detect the nephroblastoma or Wilms tumor would be CT. It's a perfect modality for that. And so far the staging is concerned, on the basis of staging you can confirm whether it is resectable or not totally resectable tumor. So I do hope that you would benefit from this video, and you will apply all this knowledge while you are scanning the patient, and you will also look for all these points at length. So keep watching my video, keep subscribing my channel, and also keep practicing the way it should benefit the other community or the community at large. Take great care of yourself. Thank you.